Imagine eating past the point of physical pain, hiding it from people you love, calling in sick to keep eating, and feeling absolutely powerless to stop. For millions of people, that's what hypersexuality feels like. It is not just wanting sex a lot. Everyone has a sex drive. This is different. Hypersexuality, also called Compulsive Sexual Behavior Disorder, is characterized by intense, repetitive sexual thoughts, urges, or behaviors that feel out of control and cause real distress or harm. It doesn't look the same in everyone. For some people, it's compulsive masturbation, sometimes multiple times a day, to the point of physical injury, missed work, or complete social withdrawal. For others, it's compulsive pornography use, hours lost daily, sometimes escalating to more and more extreme content over time. Some people compulsively seek out multiple or anonymous sexual partners, not necessarily because of attraction, but to satisfy an urge that feels genuinely unbearable. Others struggle with compulsive use of paid sexual services, repetitive infidelity, even when they love their partner and desperately don't want to cheat. High-risk sexual behavior with strangers, situations that put them in legal or physical danger. The behavior varies, but what stays constant is the pattern behind it. The urge feels urgent and uncontrollable. They've tried to stop or cut back and failed. It's causing real harm to their relationships, their career, their health, their finances, and there's significant shame and guilt afterward. And then they go right back to it anyway. That cycle, urge, act, shame, repeat, is the clinical signature of this condition, regardless of what the specific behavior looks like. This is not the same as having a high sex drive. Many people with high libido are perfectly happy and functional. Hypersexuality is when the behavior controls you. The WHO officially recognized CSBD in ICD-11 in 2018. So yes, this is a real, diagnosable condition. But it took decades of debate to get there, partly because of the stigma around anything sexual. So what is happening inside the brain? Hypersexuality heavily involves the brain's reward circuit, especially the nucleus accumbens and prefrontal cortex. It's the same system hijacked in substance addictions. In people with hypersexuality, we often see dysregulated dopamine signaling. The wanting chemical goes into overdrive. Reduced activity in the prefrontal cortex. The brake system fails. Studies using fMRI have shown that people with CSBD show similar neural activation patterns to people with substance addictions when exposed to sexual cues. This has led many researchers to classify it as a behavioral addiction, though that debate is still ongoing. Hormones play a role too. Testosterone amplifies sexual drive, but interestingly, many people with CSBD have completely normal testosterone levels. What's dysregulated isn't always the hormone itself, it's how the brain responds to it. Stress may be even more important. When stress becomes chronic, the brain's ability to regulate impulses can weaken. This helps explain why compulsive sexual behaviors often worsen during periods of anxiety, grief, loneliness, trauma, or burnout. In many cases, the behavior becomes less about pleasure and more about escape. Researchers have identified several factors that can increase risk. A history of trauma or sexual abuse appears more common among affected individuals. Certain mental health conditions, including bipolar disorder, ADHD, anxiety disorders, and depression, are also associated with higher rates of compulsive sexual behavior. Some medications used to treat Parkinson's disease can trigger compulsive sexual behaviors by increasing dopamine activity. Neurological injuries, brain disorders, and problematic patterns of pornography use may also contribute in some individuals. How common is it? Estimates vary, but studies suggest somewhere between 3 and 6% of the general population may be affected. That's tens of millions of people worldwide. It affects both genders, though it's underdiagnosed in women, partly because of how we culturally talk about female sexuality. The consequences can be severe. Relationships may collapse. Careers can suffer. Some individuals experience major financial losses, sexually transmitted infections, unintended pregnancies, depression, or profound feelings of shame. But there is an important fact that often gets overlooked. Recovery rates are actually quite high when people get proper treatment. If you have a naturally high sex drive, but it brings you joy, causes no distress, and does not negatively affect your responsibilities or relationships, it is generally considered healthy rather than hypersexuality. If you or someone you care about is struggling with compulsive sexual behavior, understand this. The situation may feel overwhelming, but it is treatable. People recover. Lives improve. And with the right support, the cycle can be broken.